San Francisco-based nonprofit Philos Health, in collaboration with local partners, is committed to providing medical, dental, and surgical services to meet the healthcare needs of people living in rural and underserved villages or barangay on the island of Bohol in the Philippines. Access to medical care and medication is unavailable or too expensive for residents living on less than $2 per person per day. Doctors, nurses, and interested volunteers travel to Bohol 3 times a year, donating their time, travel costs, and talents to provide free, acute, and preventive medical and surgical care, dental programs, health education, sustainable supplies, and training to community nurses and midwives. Each day, our teams set up in town squares or schools where the locals wait patiently to be seen. Nurses triage and partner patients with one of our physician specialists. Patients receive primary care treatment for ailments such as respiratory infections, skin diseases, TB, hypertension, and diabetes. We travel with hundreds of thousands of dollars worth of donated medical and surgical supplies, medication, and nutritional supplements, and we leave behind a well-stocked pharmacy. Surgeries happen at the local 25-bed hospital and are a collaborative effort between local operating room nurses and doctors and Philos volunteer surgeons. Between Philos physician visits, 2 local Philos-trained nurses travel between villages to follow up with patient care, provide testing, and to deliver prescriptions. Chronic disease control outcomes to date demonstrate a significant improvement in diabetes and hypertension in the adult population we serve. In June 2010, using the World Health Organization's standardized measurement tools, Philos Health discovered that 30% of the 1,100 children tested were moderately or severely malnourished. The link between hunger and disease is very strong. Philos provides hot, daily, nutrient-dense meals and multivitamins to 3,100 plus malnourished children, as well as pregnant and lactating women. Since early 2011, nearly 1.5 million nutrient-rich meals have been served. After 18 months, when reassessed, children are found to have significantly gained weight and height. Philos Health is working hard to address the serious adverse health effects of dental disease. By grade school, 95% of Hogna children have an average of 6 cavities. The consequences of dental decay are harsh: chronic pain from cavities and abscesses, educational failure due to missed school days, poor nutrition, a lack of self-esteem, and the risk of life-threatening infection. Visiting volunteers teach the children the importance of brushing twice daily, provide children fluoride-varnish treatments twice yearly, and give the children and their parents toothbrushes and toothpaste to use between visits. Philos' visiting volunteers have treated over 3,000 children since the program's inception, with the goal of reducing cavities by 30%. And it's working. Kids we see in repeat visits have reduced decay and improved oral hygiene. In partnership with the local community and government, Philos is helping to build infrastructure and capacity in order to continue medical care between service trips. Philos Health initiated a critical communication link, Hogna Community Radio, a volunteer-run, non-commercial radio station that seeks to inform and empower the people of Hogna with updates about health and dental programs, agriculture, and disaster preparedness and intervention. Gifts large and small from generous donors like you have a daily effect on each human life we interact with. A $50 donation buys 10 children a year's supply of daily, hot, nutritious meals, fortified with protein, vitamins, and micronutrients. $100 provides 15 patients with a year's supply of diabetes medicine. $250 provides 50 people with a year's supply of hypertension medicine. Donating is so simple. Visit philoshealth.org and click the donate button. Thank you, volunteers and donors. Your donation allows us to help others.